this around to the side.
Sure, Yvette D'Ath, Minister for Health and Ambulance Services. Well, it's wonderful to be here at the Logan Hospital today with the local member, Linus Power, and of course also Minister D'Ath, another local whose constituents will take advantage of these wonderful facilities that are being built around us right now. Here at the Logan Hospital, we've hit a couple of major milestones in recent times. Of course, we have the new multi-storey car park that is behind us, over 1,500 car park spaces, beautifully designed, but more importantly, providing easy access to the health facilities. And we've also opened up the refurbished maternity unit. Now, this is just stage one of the maternity unit, where we will see further works that will see an extra 6 maternity beds, 5 birthing suites, and an expanded special nursery care unit. And we will see an extra 206 ward beds as part of the Logan Hospital expansion project here. Right now we see construction happening for an extra 4 new floors above the hospital. This is a vertical expansion that will see an upgrade to many facilities across the hospital. These investments of the car park, the expansion of the Logan Hospital with new wards and upgraded facilities, as well as the upgraded maternity unit, means an investment by the Palaszczuk government of over $500 million. This construction work will be able to come online, and these facilities come online as they're completed. So we will not need to wait till the whole construction's finished to be able to take advantage of these wonderful upgrades. So many of these new facilities will come online later this year during 2023, and with the completion of all of the projects by 2024. This will support over 1,000 jobs as well during the construction, but most importantly will mean an expansion of almost half or additional beds, which we know are much needed in one of the fastest growing regions across Queensland. So we know the pressure we're seeing with bed capacity, and with an extra 206 beds plus another 6 maternity beds, this will help us with that demand that we know is here and now, and we will see these extra beds coming on very shortly. Now I'll hand over to local member Linus Power, and then we'll hear from Minister D'Ath. Thank you, Linus.
Thank you, Minister.
Sorry.
Well, being a member for a really strongly growing, fast-growing area, I had a fantastic experience this morning to be at our new school for the new school leadership, and there were 2 baby boys, twins, that are there with their grandmother and mum, and that's the kind of people that we're here working for, to see that they get the services they need in a growing area. We're surrounded on 3 sides of this triangle with fantastic initiatives. The new ward here, the new car park behind us, and over there going up is the new beds. So it's a fantastic day to be here for these refurbished maternity, but we know there's even more going on in this area. And that's because we've got a minister who understands the outer suburban areas, understands growth, understands what needs to go in this area. I also wanted to take this opportunity to recognise the fantastic staff, so many of the familiar faces that I see around here who have been working so hard through the entire COVID period. I myself got tested at the COVID testing centre here, and I know it was a fantastic thing that kept our community safe, detected the cases, and meant that we kept those cases down low. So I'm really proud to be here today, knowing that those little twin baby boys that I saw this morning are going to be in a refurbished birthing suites and going to have the best in our area, and that we've got a government that's committed to growth in this local area.
It's a terrific acknowledgement, Linus, and Minister, of the terrific staff here at Logan Hospital. This is a significant health facility on a national scale. 100,000 patients, over 100,000 patients were seen here in 2021. And as demand for local health services grows, of course, we need to keep investing in our local health network. And we know that demand is growing here in Logan. It's one of the fastest growing communities anywhere in the nation. Today, around 350,000 Australians call Logan home, and by 2040 that will grow to 500,000 Australians living here in Logan and relying on the services and staff here at the Logan Hospital. That's why our government, the Palaszczuk government, is investing now. We're delivering $688 million in new infrastructure. $190 million is being invested in new education facilities, and in our health system for Logan, $2.8 billion being invested in facilities like the ones that you see underway here, in use or in planning. And as a result, the Logan economy is booming. This expansion alone that is underway at the moment, the Minister mentioned, will support more than 1,000 jobs in construction, while providing significant opportunities in the health sector going forward. As we heard, the expansion will create 206 new beds. But this isn't all that's happening in the health space in our community. The Health Minister is also leading expansion of the Redlands Hospital, which I'm also proud to serve as a member for both Logan and Redlands. We've got satellite hospitals being built in Brisbane South and the Redlands as well, so they'll serve this community too, just a few kilometres up the road from here. And we've also heard about the Albanese government's proposed commitment for $135 million for bulk billing urgent care centres, which will complement the significant investment being delivered by the Palaszczuk Labor government. And so the prospect of an Albanese Labor government delivering greater investment in health services to complement the Palaszczuk government's investment in health services is exciting. And of course, that is all against the backdrop of cuts to Medicare under a re-elected Morrison government. Only Labor can be trusted to deliver the sorts of health services and facilities that Queenslanders deserve.
Thank you. And I do want to acknowledge the midwives and nurses that are here, particularly who work in the maternity unit. I was just hearing as I arrived that they're now receiving around 320 mums, new bubs here every month, which is extraordinary. And when you think of the 30 maternity beds that are currently here that were previously all 4-bed wards, many where 8 women would have to share one single bathroom. Now many of these will have access to single or dual rooms in which their partners are going to be able to share that room with them and with their own en-suites. That is such a significant change and improvement for the mothers and for their partners and of course the babies. So sadly I think by improving these amazing facilities here at Logan, a lot more people might come to Logan to have their babies now because the facilities are so fantastic. So I think those numbers might grow very quickly. But I do want to acknowledge the staff here. It is not easy to do major constructions like this around an existing hospital that must operate 24/7. There's a lot of disruption. And I do want to acknowledge the staff, of course the Metro South Hospital and Health Board and the executive for their tireless work to manage this and to ensure that we are still providing high quality care while all this construction continues. And I want to acknowledge also the construction companies that have been involved and are continuing to be involved in this project going forward.
Minister,
questions?
Just on COVID, New South Wales and Victoria are lifting their 7-day isolation for household close contacts. So please don't do the same.
So I'll be getting a briefing from the Chief Health Officer this afternoon on this. I'm still waiting to hear the details from New South Wales and Victoria. We know AHPPC had released a proposal of what they think should occur when we do lift close contact quarantine requirements, but that's still to be finalised. So I'm just waiting to hear from New South Wales and Victoria what the details are as far as the lifting of any quarantine requirements and what will be required of individuals who are living in a household where someone's positive and what they'll need to do.
Possible.
It is possible, absolutely. We're taking advice on it. AHPPC, as I say, have already released one statement as to what their thinking is at the current time. They suggested that this occur when we come off the current wave. New South Wales and Victoria have always been a little bit ahead of us as far as those waves, but I'll be getting a briefing from the Chief Health Officer this afternoon as to any updates from AHPPC, but also any recommendations that the Chief Health Officer has in relation to quarantining.
So could we get clarity this afternoon about?
It won't be today, but I want to see the detail of what New South Wales and Victoria are announcing as well. I am keen to see consistency. I would have liked this to be a national decision where all states and territories implement changes at the same time to avoid any confusion, particularly when we've got so many people travelling from interstate now and around the country. But I'm very keen to see the details that are released today from New South Wales and Victoria.
They're also removing the requirement for unvaccinated travellers from overseas to quarantine. Is that problematic for something like Wellcamp, which is really set up to deal with that?
Again, I am waiting to see the details. I have had some conversations with the health ministers from New South Wales and Victoria, but there hasn't been a discussion around the any changes around no quarantining of international arrivals at all. So I am keen, if they do make changes in that area, to see what those changes are, because that isn't, as I understand, a recommendation of AHPPC yet, and I don't have that recommendation from the Chief Health Officer here in Queensland.
Do you agree with the GPs that this wave may be up to 10 times worse than published figures indicate?
Oh, we've been saying this for many, many months. When the wave first hit, as some may remember, we went out and did some testing on the Gold Coast. And so in addition to people who had come forward and tested themselves and recorded those results, we had a public health team go door to door and ask people whether they would be willing to undertake testing, even though they were not aware of whether they were positive or not, and a very, very high level of people turned up positive. We did that, I believe, 3 times the unit did that, and each occasion we found people who were positive who had no idea that they were COVID positive, didn't have symptoms or had mild symptoms and hadn't tested themselves. So we have said all along that we think the reported figures are well below what's actually happening out there in the community. But most importantly, it's not necessarily the measure of how many people are reporting nowadays, as much as we do want people to report so we can see what the trend is. The fact is, the measurement is how many people are ending up in our hospital system. That is an absolute fact. That doesn't change. Even if there's 10 times the number of cases out there in the community, what matters is how many people are ending up in hospital and in ICU.
Do you have the latest figures?
I'm happy to get them. I think it's 8,995 new cases today. We have still over 500 in hospital, and I think it's around 32 in ICU, but I'm happy to get all those figures for you to make sure they're accurate. But what I do know is on our 16 plus, we are almost at 92% double dosed, which means we have such a small percentage. We have just over 6% now of the total population of 16 plus in Queensland who haven't had even one vaccine. So that's great because it's such a small percentage who have no protection whatsoever. And that means that a lot of people have come out and got vaccinated. We do want more people getting their booster, and we do want more parents bringing their children out to get vaccinated. But this is a decision for individuals now. The opportunities are there, the vaccine is there, it's readily available, and people need to make decisions that are in their best interest and the best interest of the community.
Does that sort of figure add weight to lifting the 7-day isolation?
What I want to hear from the Chief Health Officer is how he's feeling about the pressures on the health system. Obviously, we know lifting close contacts will help as far as getting more people back at work, both in the health system but in the broader community, and help businesses and the economy. But we also need to balance that with the fact that when you allow more people who are living in a household with a positive case out in the community, we will see an increase in positive cases. That is a given. and everyone needs to be prepared for that when there is changes to the close contact rules.
There's an 89-year-old lady on the Gold Coast spent several hours on the floor waiting for an ambulance. Family describes it as a broken system. Are they right?
I've seen the reports on that case. I have already spoken about what happened on that particular day. I spoke early last week when we saw an incredible surge in our 000 calls and our number of code 1s across the ambulance system. It is awful to hear those stories, and that's why we came out very quickly to advise people that we did have the 4th highest number of 000 calls that in our entire recorded history. Not since the start of the year or start of COVID, but in our total recorded history of 000 calls, the 4th highest we've ever had. And for the first time ever, Telstra initiating a pre-recorded message telling people if it is not urgent for an ambulance that they should instead call 13 Health. So we know what happened over those 24 hours. We know that people were waiting longer than they should have. And it is concerning that occurred, but it was a very, very unusual circumstance in that 24 hours.
The changes to the proposed changes to electoral laws around funding, are they an assault on democracy as the LNP put it?
Not at all. We changed the laws around state elections around 2.5 years ago now. I don't think anyone accused us of assaulting democracy at that time. In fact, a lot of the integrity bodies around this country praised Queensland for having the strongest, most transparent laws around elections that any state or territory or the Commonwealth has. And we would hope that other jurisdictions follow lead. This takes money out of politics. What we did with the changes we made, and they come into effect on the 1st of July this year, the full effect of donation caps and spending caps come into effect this year, that we have the strongest laws across the country. We said at the time that we were looking at applying this to local government as well. The CCC recommended that. We've had a parliamentary inquiry on it. The Local Government Association of Queensland and councils are well aware that we were considering this and the recommendations of the CCC, and a discussion paper's out there now for conversation. But I think it's a good thing to take money out of politics. It's not about who donates the largest sum to any individual candidate or party. It should be about a contest of ideas and policies, and that's why our laws are the best in the country.
It would still allow unions to donate millions of dollars, though. Wouldn't that give unions far too much
It's
power?
actually capping how much unions can donate. That's what people are missing in this conversation. It is actually putting a cap. Right now there is no cap on local government, and the cap for state will come into effect this year, 2 years out from the next state election. So it is important to have these caps. As I say, the integrity organisations and bodies around this country have had nothing but praise with the laws that we introduced and passed through Parliament, laws that we're extremely proud of. We are still the only jurisdiction in the country that has real-time disclosure. And of course, we have a cap on our political donations currently, where you must disclose it. Anything over $1,000 or more from any individual to a candidate or party must be disclosed in real time, within 7 days. The Commonwealth right now, any individual candidate in the current federal election could receive a donation of over $14,500 and no one needs to know. You don't need to know who's donating. You don't need to know who the donation is going to. I think that's appalling.
It's 3.8 million though from a union. Is that still far too high compared to the...
Well, there's been no decisions made as to what it should actually be. There's a discussion paper out. What rules apply at the state level for state elections is there in law right now. Everyone can see what we have put in place. But these, the caps that we put in place was done after a lot of consultation, a lot of consideration of what donations already had occurred in the past, and deemed to be reasonable. They took into account High Court, Supreme Court challenges right across the country as to what is deemed a fair and reasonable amount for parties to make donations without impeding on the ability to inform the community of different views, but what it does do is make sure that there isn't a perception that those who have the most money get the ear of candidates and politicians. That's a good thing.
Thank you.
Well done, folks.
Thank you.
Thank you.
Great out there as well.